everyone. Welcome to the October virtual walk and roll. My name is Maureen Neville, and I am the Senior Director of Programs and Marketing for the GBS Cidp Foundation. Joining me today as my co-host is our Associate Director of Development, Madeline Miller. Hi, Maddie.
Hi, Mo. I'm ready to walk and roll.
Great. We would both like to welcome you all to the second of the 2021 Virtual Walk Wrap-Up events for the Foundation. As you know, due to the ongoing pandemic and COVID-19 restrictions that remain in place throughout the country, the decision was made to convert many of our in-person walks to virtual events. This year, we introduced the Walk Celebration Boxes. Hopefully, a lot of you are using them today. These boxes were supplied with lots of good things for the teams, everything they needed to create their own virtual walk event. In the boxes were balloons, sidewalk chalk, foundation bracelets and yard signs, banners and awareness bracelets. Some of the higher level boxes included walk t-shirts and additional party accessories. So it looks like we got some great photos in and everyone's using their party accessories and having a good time.
Yeah, you're right, Maureen. Going virtual provided our community their chance to come together with their friends and family and celebrate and raise awareness and fundraise in the walk for our walk and roll in the safety of their own home, whether they were on vacation, by the pool, or local park. And boy, did they. Today, we're going to stop by some of our favorite cities and showcase some of the events that walk teams in these areas held during the summer months. You know, we continue to need your support during these uncertain times. COVID does not stop GBS, and it will not stop us from supporting patients and their families. Today would not be possible without the support of our volunteers, sponsors, donors, and of course you. We thank you so much for participating this morning and for helping to support this very worthy cause.
Yes, we'd like to give a special thanks to our 2021 national sponsors, including Grifols, CSL Behring, Kedrion, Pfizer, Takeda. We'd also like to thank our local sponsors, Soleo Health, CVS Specialty Pharmacy, and Accredo. To learn more about our sponsors and how they help patients with GBS, CIDP, and variants such as MMN, please check out our virtual exhibit space on our website.
But before we check in with our favorite cities, our Executive Director, Lisa Butler, has a message about the Foundation and what we do for our families.
Hello, and welcome to the 2021 October Virtual Walk. Whether you hosted a walk celebration in your community or are joining us just today, thank you for joining our community. I'm Lisa Butler, the Executive Director of the GBS CIDP Foundation. Our foundation is 40 years old. We have always focused on patients and families with a core mission of providing support and education, funding research, and engaging in advocacy. So I'm so proud to tell you that today, all of the money that you have raised and donated to our foundation goes directly to research. This is so needed in our area in rare disease. So I thank you for your commitment and contribution to our community. Are you a member of our organization? I hope you are if you're with us today. But if you're not, please go to gbs-cidp.org and become a member. You will be connected to so many different resources that we have. We have a robust website. You can join our mailing list. You have access to our Centers of Excellence, to an amazing global medical advisory board. You will also have access to our amazing events. We have virtual coffee chats. We have community-centered meetings that are chapter support group meetings. There's so many ways that you can connect with us and we can connect you. So please go ahead to our website, gbs-cidp.org, and become a member and join this amazing community. So today we're going to do some traveling. We are going to meet some amazing walk chairs from around the country. We're going to meet Misty Hernandez in Phoenix. We're going to meet the amazing Sue Salzman in New Jersey, Bill Ansley in Columbus, Ohio, and maybe you'll see some GBS CIDP Foundation walk staff doing a little walking on their own. I want to give a special shout out and thank you to our amazing team at the Foundation, but especially Pam Franks, Hope Carter, Maddie Miller, and Maureen Neville. So thanks so much for being with us today, and I hope you're enjoying a beautiful day wherever this finds you. Thanks again.
Thanks so much, Lisa, for joining us this morning. Our first walk this morning is one of our favorite locations, Philadelphia. If you're not familiar with the city, you may not know the city and its connection to the medical community. Not only are we home to the nation's first medical school, but actually 1 in 6 doctors are trained in Philly. The GBS Foundation office is located just outside the city in the town of Conshohocken, and we took a tour throughout town to spread awareness with our neighbors. We're so appreciative to the Philly community for their continued support of the foundation. And we also want to give a quick shout out to Megan Sherp and Team GBS for raising over $1,500. A special thanks to Tim Lehman and George Leon for their generous donations. We're so appreciative to all of your support. Thanks to those Philadelphians who came together to make a greater impact to help those living with the daily challenges of GBS, CIDP, and variants such as MMN. We would now like to welcome one of our first national sponsors, CSL Behring. Joining us fresh from the Jersey Shore is Joel. Good morning, Joel. How's fall happening down at the Jersey Shore?
Well, it's a little cloudy today, but it's a pleasure to be here, Maddie. And hello, Maureen. Thank you for asking.
Hey,
The
Joel.
Jersey Shore is always beautiful. I encourage everyone to visit the Jersey Shore. It'll make everyone very happy. So my name is Joel Nadievsky, and I'm proud to represent CSL Behring as a sponsor of this very important event. CSL is a global biotherapeutics leader driven by our promise to save lives. We meet patients' needs using the latest technologies to develop and deliver innovative biotherapies that are used to treat serious and rare conditions. We manufacture subcutaneous and intravenous therapies for the treatment of CIDP. For more information, please visit our websites, www.hizentra.com and www.privigen.com. I would also like to give a special shout out to CSL Plasma. We operate CSL Plasma and rely on plasma donations to make our therapies. Please visit cslplasma.com for a listing of our centers. Once again, thank you so much for having CSL Behring be a participant of this very important event. So back to you, Maddie and Maureen.
Thank you so much, Joel, for joining us, and thank you for your continued support. To learn more about CSL and our other sponsors, don't forget, you can check out the virtual exhibit space. It's located on our walk page on our website under the virtual exhibit hall menu. So on to our first virtual stop, and our trip across the country will be, our first stop will be Columbus, Ohio. Now, did you know Ohio boasts having the very best library, the Columbus Metropolitan Library, also the very best zoo, the Columbus Zoo, the best science center, Center of Science and Industry, and, yep, the best college football team, the Ohio State University. Joining us now is another best, the best walk chair and Columbus liaison, Bill Ainsley. Hey, Bill, how are you?
Very good.
Good to
Hopefully
see
you can
you.
hear me. Can
We
you
can
hear me?
hear you. Yep, we
Yeah.
can hear you.
Good to go.
You're
All right.
good.
What-
So,
all
Bill,
right.
you had, yeah, good morning. So you had GBS back in the 60s, and I'm sorry if I'm dating you. I'm also a child of the 60s, so I'm allowed to do that. So it must have been a little difficult for you back then. There was no foundation. There was no information. You were a child. Can you tell us a little bit about that?
Right. So thank you for that great introduction here in Columbus. And today is Buckeye home football game. So here in another hour or two, this place will get really crazy. But for now, a little bit about myself. I was diagnosed with GBS back in the late 60s. And at that time, there were no treatments. It was just relative comfort care. And if you made it through, you made it through. If you didn't, you didn't. So back then, of course, they didn't really have great tools to diagnose GBS or CIDP. So, of course, I was diagnosed with MS and muscular dystrophy and all the other types of inflictions that they could put on it until finally, a couple weeks later, they brought a neurologist in from Columbus here from Nationwide Children's Hospital, and she had diagnosed me with GBS. So I was then transferred to Children's Hospital here in Columbus, where I spent the next month or two recovering. The one thing about it, though, is I share in common with everybody else is I had the same exact symptoms. You know, my legs started to get real sore, then I started to fall down, then my arms started to get real sore, and after a while, it just kept getting worse and worse. So then finally, they got me here at Children's, and I started my recovery. So luckily for me, I was never put on a ventilator. So that part of the experience I did not know, but I experienced everything else. I was completely paralyzed from head to toe. Once I started to recover, I can sympathize with everybody else, but the worst part for me was the physical therapy, because my legs and arms were so sore and so tight that when they come in to start working on me, it was tough. So I understand what everybody's going through. It was a difficult time. The other thing too is when I was able to finally start eating, all I could have was broth and popsicles. And to this day, I do not like broth. I won't eat it if even I have. So that was one of the bad things about then. But I had a total recovery. I'm up and running now. I have, as I mentioned before, I'm the Central Ohio or the Columbus liaison for the foundation. I'm also the regional director for the North Central region. So anybody out there in my states, hello, welcome from Columbus. But I did want to mention just briefly, the reason why I got involved into this foundation was I wanted to do something to give back to the people that have this now. And that's why these walks are so important, because they are one of our main avenues to get donations to come in. So I do want to thank everybody that helped participate in these walks. I do want to mention Avery's squad. Sarah Sappel helped with the squad. They raised a lot of money. My top individual is Linda Magali. Thank you very, very much. And just yesterday, we got a donation from one of my best friends who actually was right with me when I first started the foundation, Aaron Newman. Aaron, if you're out there, thank you very much for that donation. And I think that you want to say something. Oh, here's my little grandson that was with me last year, and now he's back. There he is. You want to say hi, Harley? You want to say hi? Yeah, there he is. He was with me last year. This is our second year in a row. You got anything else to say? No, I guess we're quiet today. So anything else for me? I think I hit everything.
Yeah, you got it, Bill. Thank you so much, Bill, for joining us this morning. Enjoy the game today. Welcome, Columbus. Thank you for all you do.
One of the reasons we walk is for research. The foundation's research grant initiatives focus on diagnosis, treatments, and genetics. We will now hear from our coworker, Chelsea Fix, the foundation's Senior Manager of Research and Advocacy, who will talk to us about the importance of the research grant program.
Hi, everyone, and thanks for joining us for our virtual walk and roll program for research. I'm here to tell you a little bit about how the foundation supports research, and we want to thank you for all of your time and contributions, because this would not be possible without you. So a little bit about our research program. One of the most important ways and most significant ways in which we get involved in research is by giving out research grants. There are 3 types of grants that we give out. Number 1 is called the Elevation Award. And these grants are 1 year. They're a little bit smaller, but the idea is that these awards go to researchers who are newer, younger, and just getting started in GBS CIDP research. We want to make sure that they have an opportunity to follow their passion in GBS CIDP and realize that they can get funded and that they should continue to research GBS CIDP and variants. Number 2 is Discovery Awards. These are bigger awards. They span over 2 years, and they typically go to researchers who are a little more experienced in answering more complicated or more complex research questions. The idea is that these researchers studying a complicated research question can get their start on that project with our Discovery Award, and then eventually get funded by a larger entity such as the NIH to continue that important work and keep making good discoveries. The last type of award that we give is the Benson Fellowship. We give this award every 3 years to one particular person with a very strong interest and strong research background in GBS or CIDP. And that person then becomes our Benson Fellow and does a very specific and complicated research project over 3 years that does help to better our understanding of GBS CIDP. All of these awards typically fund basic research, and that's what we call lab science. It's the researcher at the lab looking at molecules and all of that important work that eventually helps us better understand treatment pathways or diagnosis pathways for GBS, CIDP, and variants. We also support other types of studies, sometimes called translational research. And that's really sometimes also referred to as bench to bedside research. So it's what's happening in the lab and what's happening in the field or at the clinic, and how those two ideas come together and mash. So we support IGOS, which is the International Guillain-Barré Outcome Study. And that's a long-term observational study, really looking at the natural history and natural progression of GBS in people who have had the condition. We also support Gbs. It's another long-term observational study, and that is looking more specifically at CIDP and the natural history, natural progression of people living with CIDP. So those are our major ways of which we support research, and we could not do it without you. Thank you so much for being here, and we hope to see you again in the future.
Thank you so much, Chelsea, for explaining all the ways that we are involved in all of that research. The GBS CIDP Foundation International believes in supporting research in GBS, CIDP, and variants by funding grants for projects that contribute to the knowledge of and towards an eventual cure. To date, we have committed over $5 million towards basic and translational research. You can learn more about our research and initiatives by visiting our website.
Great. Next, we would like to introduce you to Jim Jones with Grifols. You can get a little bit of alliteration there to chat with us for a bit of a good morning. Good morning, Jim Jones from Grifols.
Good morning, ladies. I'll answer to whatever. That's fine. Thanks for having me again. It's a pleasure to be here. My name is Jim Jones. I'm calling in from Omaha, Nebraska this morning, and I am the patient advocacy coordinator for Grifols. And I just want to say that Grifols is a very proud sponsor of the GBS CIDP Foundation. One of my very first activities and tasks with this company was to attend patient events, and it's just left such an impression on me, and it's something that I'm individually passionate about. So it's wonderful to work for a company that's passionate for patient advocacy and patient events. I just wanted to share that Grifols is the manufacturer of Gamunex-C, which continues to be the #1 IG prescribed for CIDP. So as such, I'm sure there's a lot of folks out there that are very familiar with Gamunex-C. I wanted to provide you with the website for Gamunex-C, which you see on the screen here below me. And this is a wonderful resource if you have any questions regarding patient, really any patient type questions. We also have a copay assistance program on that website that is $2,500 per year, which is really intended to help offset any costs associated with that therapy. And you can also find clinical information to any questions you might have on gamunexc.com. The next and last website I'd like to share with you is simply grifolsplasma.com. I think it was mentioned earlier that, we couldn't do what we do without plasma donations, and there continues to be a need for plasma donations worldwide. And I think this is a wonderful resource that can be utilized. Share it with your family, friends, coworkers. By going to this website, you can find the donation center nearest you and really make a difference for this community to make sure that therapies are available in the future. So I just wanted to share a few of those resources with you today. I hope everyone has a wonderful walk. It's a pleasure to be here. Thanks again for having me, and I'll send it back to you, ladies. Thanks.
Thank you, Jim, and thank you so much for Grifols' continued support. Remember, you can learn about our sponsors by checking out the virtual exhibit space located on our website. Next stop on our tour is Phoenix, Arizona. Did you know that 85% of Arizona is comprised of national forests, parks, recreation, wildlife areas, wildlife preserves, and reservations, and that Phoenix itself has over 200 golf courses? I guess that would explain why my dad would take our family there constantly on vacation. But we want to welcome Misty and have her share her story.
Thank you, Maureen and Maddie. And thank you all for taking time out of your busy Saturday to be here with us. My name is Misty Hernandez. I am the Arizona liaison and the Phoenix Walk Chair. As many of you know, we do these walks to fund research. Research is important for providing quicker diagnoses and hopefully one day potentially leading to a cure for diseases like I have, CIDP. My story is a little bit different. In 2018, I was going to a doctor already because for years I was feeling clumsy, falling down, and getting weaker all the time. And I kept being told that because I was overweight, I needed to just lose weight and it was fibromyalgia. That wasn't the case, as it isn't for a lot of patients that are just like me. After I continued to see a doctor, I finally got a diagnosis of GBS. With the help of the foundation, I was able to see a Center of Excellence doctor who correctly diagnosed me with CIDP. So without the foundation, I don't know if I would have received the correct diagnosis or the proper treatment that I needed for my medical condition. That's why walks are so important. We need to be able to bring awareness to GBS, CIDP, and other variants, as well as help provide tools and resources for other patients, and to be able to fund research to create a cure for GBS and CIDP and other variants. One day, my dream is that there'll be a cure for CIDP. One day, my dream is that other patients aren't going to have to experience what I experienced by going to multiple doctors and being told it's all in their head or that nothing is wrong with them. They'll be able to go in, doctors will be able to know what is wrong with them, and GBS, CIDP, and other variants will be known to them. We can do this through raising awareness. I also want to encourage you guys to get involved with advocacy. A lot of people don't know that October is a month of advocacy at the GBS CIDP Foundation. For more information, you can visit our website, www.gbs-cidp.org, and you can contact Chelsea. She's in charge of the advocacy team, and I'm sure she'd be more than happy to work with you. I want to thank each and every one of you for coming out today, for supporting us, for being a caregiver and taking care of us when we needed our most, for being a patient and pushing through every day, for all the struggles that you go through. We see you and you are not alone. Thank you for being here with us today, and we just so appreciate you.
Thank you, Misty. We appreciate all that you do, your inspiration, and that you share with your community and with us. And just thank you so much for joining us today.
So now we'd like to share with you a message from one of our national sponsors, Takeda.
Good morning and good afternoon to everyone. My name is Costanza Barberis, and I am the Marketing Director for Neuroimmunology at Takeda. Takeda is a patient-focused, value-based, R&D-driven global pharmaceutical company dedicated to serving patients by providing innovative products that improve their lives with better healthcare. Takeda is committed to supporting patients worldwide across several therapeutic areas. Plasma-derived therapies represent one of Takeda's key areas of focus, and immunoglobulins are critical life-saving medicines that thousands of people with rare diseases rely on every day. Takeda has something unique, something we call patient trust reputation business. Patient trust reputation business is the framework that has sustained us for over 240 years and distinguishes Takeda from other pharma companies. It's what keeps us focused amidst uncertainty, as during this unprecedented COVID era, and ensures that our decision-making remains connected to what matters most, putting patients first, and doing it in a way that fosters trust, enhances our reputation, and creates a successful and sustainable business. We are very proud to be here with you today and to be able to support the GBS Cidp Walk and Roll events, as well as the Foundation's other activities, as we strongly believe in the importance of continued research. At Takeda, we endeavor to develop methods that will help reduce time to diagnosis, offer the right treatment for the right patient, and support the scientific innovation in understanding rare disease physiopathology. Thank you for having us with you today, and we can't wait to walk and roll.
Thank you so much, Takeda, for your continued support. Don't forget to go to our website, learn more about all of the sponsors that you're hearing from this morning. You can check that out by going to our walk page and the virtual exhibit space right on the walk page. Our final stop on our tour today is Basking Ridge, New Jersey, my old stomping grounds. Here is a special message from our walk chair, Sue Salzman.
Hi, thank you, Maureen and Maddie. I am Sue Salzman, and I am the chair, or have been the chair, of the New Jersey Walk and Roll for the past 9 years, I believe. The last 2 years have been virtual, unfortunately, and we're very much looking forward to hopefully next year being in person again. I lost my husband in 2009 to CIDP after a fierce and horrible 9-month battle. I was his caregiver, and going through the process of finally being diagnosed was very, very difficult. After many hospitals, many doctors, we finally made it to the University of Penn Medical Center, where he was officially diagnosed with CIDP. It was a very long battle, very hard. He had a month in Kessler Rehab Center, but in the end, he lost the battle in October of 2009. He first got ill in February of 2009. So it was a very short and very fast illness. My first experience at a CIDP walk was a couple of years later. It took a couple of years, but I went to a walk in Pennsylvania, and I knew right away, as soon as I got there and saw the people, that I needed to do something for New Jersey. New Jersey did not at that time have any walks. In fact, before Tom was diagnosed, I had never heard of CIDP. GBS, yes, but CIDP, no. But when I got to the walk, I couldn't believe it. There were people with CIDP walking around. A few were in wheelchairs, but a few were in remission and had lived and survived CIDP. So it was an eye-opener for me. And I knew right then that I really needed to help do something to make awareness more available. And we needed to raise a lot more money for research. When I got home, I mentioned it to my family, and they were on board 100%. And from then on, we have hosted the New Jersey Walk and Roll. A few years ago, I thought I might, maybe I should pass the torch to someone else who might have some better ideas and some new ideas to raise even more money for the foundation. But my 6 grandchildren got very upset and said, "Grandma, you can't possibly give this up. You have to do it for Grandpa." So we will continue to do it, of course, as long as we possibly can. We talk about Tom all the time. But on the walk day, it's just a special connection we all make with him. Before I go, I just wanted to say thank you so much to all of the families who have been coming back year after year to our walk. We've gotten to know quite a few of them, and I have to say we have missed them all in the last 2 years. I would like to say a special thank you to Sue Claire, who I met through the Walk and Roll, who had also lost her husband to CIDP. and also to Barney Rafferty. He's our resident bagpiper. He comes every year and he sends us off with his bagpipes and his beautiful music, and greets us at the finish line as well. He, I believe, has had GBS. So I just want to thank all of our New Jersey friends and hope to see them next year in person at our walk and roll in New Jersey. And good luck to all the fall walks. I hope they were all successful and will continue to be successful. And thank you to Maddie and Maureen. And I will send it back to Maddie and Maureen. Thank you.
Thank you so much, Sue, for sharing that personal story and for your wonderful message. We so appreciate all that you and your family have done for the past 10 years. And we do hope also that we will be listening to the bagpiper together next year. We can't wait for that, and we can't wait to give you a hug. So on to our next segment. Last but not least, we'd like to introduce you to our final sponsor representative of the day, Hans Spandl. Hopefully, Hans, I'm getting your name right. He is with Soleo Health. He's joined us to chat for a bit. And good morning, Hans. Can we hear Hans? Okay.
Okay. Oh, looks like we're
Well,
having a moment to get Hans. But
okay.
Maureen, that was such an incredible message that
I know.
Sue shared with us. And it reminds me of why all of our walk chairs, volunteer their time. And it takes a lot of time to plan these successful walks. So I just want to
It
give
really
a huge
does.
shout out to all of our walk chairs. And, like Sue mentioned, I'm really excited that tomorrow we're actually having our first in-person walk in Washington, D.C. So it's going to be great to be back. Oh, Hans, I think we're going to try this
Are we
again.
back?
Can you hear us, Hans? Nope. Okay. Well, hopefully we will see many people out, at the monument tomorrow. I know you've been with the foundation. I know you've been with the foundation for a couple of years. Do you have a favorite walk location?
I actually really enjoyed the DC walk last year, I have to say, or I guess it was 2019. DC, and I have to, of course, say the Philadelphia walk, which took place right outside here in Conshohocken.
Yeah.
I think we had 100 people at least at that walk. And of course, our founder, Estelle Benson, was with us, which is always a wonderful treat. Hopefully many of you have met Estelle. If not, join us for the senior coffee chat on Tuesday. There's a senior coffee chat at 1 p.m. on Tuesday this week. So look for that Zoom link and sign up for that if you're interested in meeting Estelle. So
yeah, I would have to say I have been to the Staten Island walk with our one of our favorite walk chairs, Crystal Sada, and I have never been to Staten Island before. I did not know just how scenic Staten Island is.
Agree. I remember the videos. It's beautiful right along you forget it is an island, right? So there's always a water view there, a view of the water.
Yeah. And then in 2 weeks
Okay, so we're hearing that we can't. Yep.
Okay, well, I was just going to say, in 2 weeks, Pam and I are traveling to Charleston for another walk. Or no, next week, Charleston, and then we'll also be having an in-person walk in San Francisco. We can't wait for the in-person walks, but we're even more excited to hear from Hans.
Okay.
Yeah,
all right. Well, we're having some difficulty with the Soleo representative. So we do thank you, Hans, for joining today. You can learn all about Soleo Health at our virtual exhibit space on our walk page on our website. So please go and visit that when you get a chance.
Yes, definitely. And we want to take a moment to thank, we have just 2 more sponsors to mention. We have a message from Kedron. Unfortunately, Steve was unable to join us, but we do have a quick message about Kedrion.
Guys, I really appreciate the time. It's so exciting to be a part of this, and I appreciate the opportunity to talk with everybody. My name is Steve Higgins. I'm a territory manager with Kedrion Biopharma, and I'm based in Kansas City. Kedrion's been participating in the walk and roll events for quite a long time now, and it's always a very special time. So I'm grateful to have the opportunity, as I said, to participate. You may have heard about Kedrion Biopharma from events in the past. If not, I just wanted to touch on our company a little bit, just to give you a little idea of what we're about. We're a little different because we are a family-owned organization and run a little bit differently than some of the others. Here at Kedrion, we really have a relatively small footprint in the United States, but we are very passionate about what we do for our patients and those that we serve. You know, as I mentioned before, we're a little bit different. We're family owned. We have roots to go back many decades in Europe, but we've come a long way here in the United States. We've been in the U.S. for about 10 years now, and have been working with the Gbs Cidp Foundation for probably 5 or 6 of those, and it's been a fantastic experience. Our global headquarters is in Tuscany. In Tuscany, Italy, believe it or not. And of course, the first thing everyone asks me is if I've had a chance to visit the area and get out there. Unfortunately, I've not been invited to Italy as yet, but it's a beautiful shot. I've seen it as you do through the photographs. But this is a picture of one of our manufacturing facilities in the Lucca, Italy area. I just love the backdrop there. I hope to get there soon. I have been to our U.S. headquarters, which is based in Fort Lee, New Jersey, just across the George Washington Bridge there from Manhattan. Been there to that location a number of times. These are just a few pictures of some of our presence at previous walk and roll events. You know, whether they're live or virtual, we really enjoy the opportunity to support the community and to be able to participate in these events. Just a quick word about our product. And that's GammaKed. GammaKed is a 10% IVIG solution. As you can see on the slide, GammaKed has indications for primary immunodeficiency, ITP in adults and children, and also CIDP in adults. And you know, we've been on the market for a number of years. And you know, with any of these products, GammaKed, like all the others, does contain a boxed warning relates to thrombosis and kidney dysfunction. So I would always encourage everyone, read your package insert, talk with your healthcare provider, and get the education that you need on these products. But that's the one that we have out on the market. Let me just, in the interest of time, I'm going to skip to the last one of my slides here. I just encourage you, if you want to learn a little bit more about Kedrion as an organization, just go to www.kedrion.com. Get a chance to learn a little bit more about how we came to the United States, a little bit about the family in Italy, as well as the portfolio of products and disease states that we work with. So just another opportunity to learn about the company. So with that being said, I really want to thank the Gbs Cidp Foundation, Pam and Maddie, for having me on there. I really do appreciate it, and I'll go back to Pam and Maddie.
Great. Well, we've had such a wonderful time today meeting our walk and roll chairs. These walk and roll chairs have taken time to plan walks that raise money for groundbreaking research, like Chelsea described in our earlier video. Today, with the help of you and our walk chairs, we've raised over $65,000 for research. Isn't that fantastic, Maureen?
That's amazing. So excited and so grateful for that.
This would not have been possible, of course, without the support of our national sponsors. And I want to just share one last message with you from one of our newest national sponsors, Pfizer.
At a time when things are most uncertain, we turn to the most certain thing there is: science. Science can overcome diseases, create cures, and yes, beat pandemics. It has before. It will again. Because when it's faced with a new opponent, it doesn't back down. It revs up, asking questions till it finds what it's looking for. That's the power of science. So we're taking our science and unleashing it. Our research, experts, and resources, all in an effort to advance potential therapies and vaccines. Other companies and academic institutions are doing the same. The entire global scientific community is working together to beat this thing, and we're using science to help make it happen. Because when science wins, we all win.
You know, even though the pandemic and COVID restrictions continue, we have so much going on here at the foundation. I invite you to check out our latest news and events from the community on our events calendar, which is on our website under support, to see all of our upcoming events. To everyone in the DC area, we hope to see you at our in-person walk tomorrow. And we're looking forward to also seeing our community members in Charleston, South Carolina, San Francisco, and San Diego in the coming weeks. We also have virtual chapter meetings going on, and we just had a very successful virtual summit last week. So lots of things happening here in Conshohocken at the Foundation's office.
Thanks, Maddie. And thank you again to all of our participants, our sponsors, our staff, our walk teams. If you're out there walking, keep walking. Thank you to my co-host, Maddie. And your continued support for research is helping GBS and CIDP patients all across the globe. We hope next year to see you at the walk and roll in person, and we hope you have a great afternoon. And thank you so much for joining us.
All right, thanks. Bye-bye.
Bye-bye.